Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to play medical detective. We're going to follow the clues to solve a really specific and, a very persistent problem.
So what if that simple buzz in your ear wasn't so simple? I mean, imagine a constant buzz in just one ear. Super annoying, right? But what if that sound was actually a signal, a clue to something much, much deeper going on inside your brain? Well, that's exactly where our case begins today.
Okay, every good investigation starts with the facts of the case, right? So let's meet our patient and see what clues we have to work with.
So here's the story. We've got a 33-year-old man, and for the last 6 months, he's been dealing with two things, both in his right ear. First, this persistent buzzing sound, what doctors call tinnitus. And second, he's noticed his hearing in that same ear has gotten worse.
Now, here's where it gets really interesting. The first thing doctors did was rule out all the common stuff. Ear infections, fluid buildup, maybe damage from going to too many loud concerts. But nope, none of that was the cause. So the trail didn't go cold, it just got way more fascinating.
All right, so with all the simple explanations off the table, the investigation had to go deeper. We're talking about looking at the very wiring of the brain to figure out what's going on.
And boom, here it is, the big break in the case. An MRI scan reveals the cause. It's an intracranial tumor. I mean, a tumor inside the skull. This is obviously a huge development, but it just leads to the next big question. What is it exactly? What kind of tumor are we dealing with here?
The diagnosis? It's a vestibular schwannoma. Now, you might have heard of something called an acoustic neuroma. It's the same thing. But vestibular schwannoma is actually the more precise term, and as we're about to see, that name itself holds some major clues.
So what in the world is that? Well, first off, it's benign, which is good news. It means it's not cancerous. The key part of the name is schwannoma. That tells us it grows from something called Schwann cells. And the easiest way to think about Schwann cells is like the plastic insulation that wraps around the electrical wires in your house. They help the signals in your nervous system travel super fast and efficiently.
Okay, so to figure out which nerve this thing is growing on, we need a map. And here we have the perfect one. This is the brainstem. It's basically command central for the body's 12 cranial nerves. For our purposes, think of this as our big investigation board.
All right, now it's time to zero in on our prime suspect. We've got the symptoms, we've got the location. Now let's connect the dots. Okay, let's go back to our map. The tumor is sitting right on this guy here, the vestibulocochlear nerve, also known as cranial nerve number 8. You can think of this nerve as the main information highway that connects your ear to your brain. It's responsible for carrying all the signals for hearing and for balance.
So this is how it all connects. How does this one tumor cause both of the patient's symptoms? Well, it's a 2-for-1 deal. First, the tumor is physically squishing the part of the nerve that handles hearing. That blocks the real sound signals from getting through, and bam, you get hearing loss. At the same time, the tumor is irritating the nerve, which creates all these fake, random electrical signals. The brain doesn't know what to do with them, so it just interprets them as a constant buzz. That's our tinnitus. See, it all fits perfectly.
But the investigation doesn't stop there. See, with a tumor like this, it's not just about where it is now, but where it might go. We have to think about the neighbors, because as this thing grows, it can start causing problems for everyone on the block. This tumor is growing in what's basically a very crowded neighborhood in the brain. It's a spot called the Cerebellopontine angle. It's a really tight space where a bunch of super important nerves all come together. So you can imagine, as the tumor gets bigger, it starts to run out of room and begins pushing on those other nerves.
Let's look at our map again to see who we're talking about. The closest neighbors to our cranial nerve 8 are cranial nerve 7, that's the facial nerve, and cranial nerve 5, the trigeminal nerve. They're literally right next door, so they're the most at risk if this tumor keeps growing.
So what happens if these neighbors get pushed around? Well, if the tumor compresses cranial nerve 7, the facial nerve, you could see things like facial weakness, maybe even paralysis. And if it pushes on cranial nerve 5, the trigeminal nerve, that can lead to numbness in the face or mess with the corneal reflex in your eye. This is exactly why a bigger tumor can show up with a whole bunch of different symptoms, not just the hearing issues.
Now, any good detective knows you have to rule out all the other possibilities. So let's do a quick lineup of the other local suspects and see why they just don't fit the crime.
This table makes it super clear. Let's look at the evidence. If the problem was with the facial nerve, the first symptom would have been facial paralysis. Doesn't match. If it started on the trigeminal nerve, it would have been facial numbness. Doesn't match either. And the abducens nerve? Problems moving the eye. Again, nope. None of these line up with our patient's first complaints, the ringing and the hearing loss. So yeah, case closed on these other suspects.
So, we've followed all the clues, we've ruled out the other suspects, and now we've arrived at the solution. This is the big takeaway, the clinical clue that cracks this kind of case.
And here it is, plain and simple. This is the diagnostic pattern you need to remember. If you have a patient with tinnitus and hearing loss, but only on one side, your number one suspect has got to be a vestibular schwannoma on cranial nerve 8. It's just a classic pattern.
But wait, there's one last twist to this mystery. What if a patient shows up with these tumors on both sides, not just one? Well, that is a huge, flashing red light of a clue that points to a specific genetic condition called neurofibromatosis type 2, or NF2 for short. It's an absolutely critical distinction to make.
So you see how a single, kind of simple symptom, a buzz in the ear, can unravel a whole complex mystery hidden deep inside our own bodies. It really makes you wonder, doesn't it? What other medical mysteries are just lying there, waiting to be found, in the incredible, intricate wiring of our brains?